Hello, everyone. Thank you so very much for joining us today for this webinar on navigating menopausal changes, knowing that managing our aches and pains and pelvic health, where we'll be addressing the various symptoms and discomforts associated with menopause, while specifically highlighting the importance of managing aches and pains and pelvic floor health during this life stage. My name is Kim Fancher, and I will be your host today. I'm very proud to be part of Positive Health's webinar series where we're able to bring experts in to share some really great information on menopause topics that are important to you. During this presentation, we anticipate that you will have some questions for our guest speaker. So we ask that you please type in your questions in the chat and we'll share them with her at the end so that she can provide a response. We believe we've carved out enough time to address all your questions, so please don't be shy in submitting them. I also want to mention there is a show captions feature that you can use with this webinar, found at the bottom of the Zoom app where you can select the preferred language. And we want to let you know this webinar will be recorded so we can make it available to those that want to view it on demand. So now to get us kicked off, I am thrilled to introduce our guest presenter, Dr. Kelly McLaughlin from SimpleTherapy. She leads their MSK program. Thank you so much, Kelly, for being part of our Positive Health webinar series. I think we would all be interested in hearing a little bit about your career and how you got started in this space, if you don't mind sharing that with us.
Sure, absolutely. Thank you so much, Kim. I am looking forward to this opportunity of sharing this information with everybody. As Kim mentioned, I am Kelly McLaughlin. I'm a doctorate of physical therapy. I'm a certified athletic trainer, and I'm also a certified McKenzie provider. Been practicing physical therapy now for almost 25 years, all focused in the outpatient orthopedic realm of things. However, over these past couple of years, as I have personally started to navigate my menopause journey, that has definitely become a higher interest and a priority in my knowledge base. So I'm even more excited to be able to share that with you all as I've done learning all on my own experiences, but am able to provide it in a professional opinion and realm to everybody here too. So thank you for joining us today. And as Kim mentioned, topic today is navigating the menopause journey, managing the physical changes and the emotional distress. So we'll get started today by kind of dividing our topics up into 4 different sections. We'll divide them into menopause and how it's defined, perimenopause and its definitions, the physical changes and symptoms associated to this journey, and caring for ourselves during this life transition. So let's dive right in. What is menopause? Navigating through menopause is a natural stage of life. It's marked by the absence of a menstrual cycle for a consecutive 12-month period, provided your uterus is still intact. For those who have had a hysterectomy, seeking guidance from a healthcare provider can help determine whether testing is necessary or if the factors could be associated to other medical conditions that are causing your symptoms. On average, menopause typically occurs around the age of 51, although it may occur earlier in women of color. The duration of menopause can vary greatly due to a multitude, a range of factors. These include our age, our genetics, lifestyle choices, our body compositions, pre-existing medical conditions, medications we may be taking, and race or ethnicity. Understanding these variables can provide insight into the unique experience of menopause for each individual. Perimenopause is the period leading up to that 12 consecutive months with no menstrual cycle. This is when women or individuals assigned female at birth may start noticing changes in their menstrual cycle and experience symptoms, common one being hot flashes. Perimenopause typically begins in our mid to late 70s, but again, this timing can vary. The average duration of this hormonal transition is about 7.5 years. Though it can be longer, especially for women of color and other individuals, this entire time frame is considered perimenopause. Making certain lifestyle choices during this phase can help manage the severity of our symptoms. Regular exercise has been shown to be very beneficial, along with a healthy, balanced diet and maintaining a healthy weight is also recommended. Stress management techniques have also been shown very helpful in mitigating the severity of symptoms, along with reducing alcohol consumption that may also help alleviate or reduce some of these symptoms. Additionally, factors like your pregnancy history, environmental influences may also impact the period of time in perimenopause, although some of these factors are a little bit out of our control. So what is the catalyst for all of this change? The pivotal factor during these changes is the decreasing level of estrogen that's present in a woman's body. Estrogen is a naturally occurring hormone in individuals assigned female at birth, and it serves a crucial part in regulating various aspects of our reproductive health. It signals the body when to initiate and to cease the processes that affect reproduction. Moreover, estrogen plays a vital role in shaping secondary sexual characteristics and influencing significant transitions in our body, such as puberty, menstrual cycles, fertility, pregnancy, and notably our menopausal journey. So as mentioned earlier, there are physical changes and symptoms that are associated with our menopause journey that can commence as early as our mid-40s. While these experiences differ from woman to woman, they often encompass a range of manifestations. Sleep disturbances, reduced and decreased energy levels, and emotional distress are very common. Additionally, women may observe various physical changes, including weight gain, alterations in their body composition, and the appearance of their bodies, such as bloating and increased abdominal fat. Changes in the bowel and bladder functions, along with potential pelvic pain, are also physical signs, symptoms, and changes associated with our menopausal journey. Sleep disturbances. They are probably the most prevalent among women during this menopausal journey. Factors such as hot flashes, night sweats, and anxiety related to menopause often disrupt our sleep patterns, resulting in chronic fatigue. Furthermore, depression and emotional distress can contribute to difficulties in obtaining sufficient high-quality sleep. Sleep disturbances can lead to decreased energy levels, making it challenging to engage in the physical activity throughout the day, not only those that we need to do, but those that we choose to do. Additionally, poor sleep habits can exacerbate irritability, mood swings, and further impacting our daily functions. Our emotional and mental changes, such as mood swings, irritability, anger, and even feelings of rage, often stem from these hormonal fluctuations and can serve as the catalysts for anxiety, depression, and stress, thereby adversely affecting our overall well-being. This interconnected cycle and loop underscores the profound impact that hormonal changes during menopause can have on various aspects of our mental and our emotional health. Some of the physical changes we may know. Some of them may be physical, some of them may be visual. But a woman's body is likely to undergo various changes, both in this physical aspect and the visual aspect. It's likely that we'll have muscle loss, which is a natural aspect of aging in itself, but it can be accelerated with the decreased hormone production during the menopause journey. Our lower estrogen levels also affect the way that our body processes carbohydrates and fats, which potentially result in that extra weight gain, that increased abdominal fat, and puts us at higher risk for conditions like high blood pressure, high cholesterol, and diabetes. The decreased estrogen levels also contribute to stiffness and achiness in our joint, compounded by the normal muscle loss of aging and the aggressive muscle loss potential of the menopausal journey. It makes it difficult to be consistent with physical activity, which also causes the increase in achiness and stiffness in our joints. We'll often see this stiffness and achiness in our weight-bearing joints, such as our hips, low back, knees, feet, and ankles. The decrease in estrogen has also been shown to be a trigger for headaches and chronic migraine fatigue. Bone health is also directly influenced by the muscle loss and the fluctuating hormone levels, potentially leading to premature bone degeneration, which we also refer to as osteoporosis. This diagnosis and/or osteopenia, which is the beginning stages of osteoporosis, which is reduced bone density, increase our risk for falls, fractures, and complications following those fractures or with the treatment of those fractures. Our pelvic floor health. So during this transition phase of our life, the pelvic floor muscles can undergo significant changes. Just like those weight-bearing joints and other muscle loss, our pelvic floor is no different. While it is imperative for women to consistently prioritize the maintenance of their pelvic floor health, this task can become notably more challenging during this particular life stage. Manifestations indicative of a pelvic floor weakness include instances such as urinary leakage during, but not always, with actions like coughing, sneezing, or laughter. We can also experience frequent urges of urination and bowel functions, and alongside also symptoms of constipation. Furthermore, discomfort during sexual intercourse due to vaginal dryness is very prevalent and often a high concern during this transition. Pelvic organ prolapse, otherwise known as POP in the medical world, often presents as a sensation of heaviness in the vaginal region. While not deemed a medical emergency, prompt medical attention is strongly advised in this situation, given that it's typically associated with protrusion of one or more internal organs through the vaginal cavity. So now that we've discussed some of the information as far as frequency, duration, time periods, and some of those signs and symptoms that manifest during this journey, your next question is probably, how do we manage this journey? And transitioning through menopause can indeed be challenging, but there are strategies to help make this journey smoother. By implementing the following strategies, you can help ease the transition through menopause and embrace this new stage of life with confidence and vitality. Managing the stress and anxiety. Easier said than done sometimes. However, especially during this menopause transition, it is crucial for overall well-being. Some additional strategies to consider is to be proactive, to recognize your signs and symptoms early and seek professional care. Don't wait. Make time for yourself. If you're like me, that requires it actually putting it on my calendar. So schedule regular me time on your calendar. Prioritize it and don't skip it. Incorporate daily exercise, aiming for about 30 minutes of light exercise, such as a walk, to improve your mood and reduce stress. Prioritize your sleep. Aim for getting 7 to 8 hours of uninterrupted sleep per night to support your physical and mental health and well-being. Establishing positive daily habits. Maybe consider something like meditation or integrating quiet time into your regular routine to promote relaxation and mindfulness. And as previously mentioned, not skipping that. Sticking to a routine can also help. Consistency, providing structure and stability during this time of change can provide positive results. Utilize all your available resources. Dig deep into those opportunities. Take advantages of services like your employee assistant programs, mental health care, and digital cognitive behavioral health tools, such as those offered through your membership with Positive Health. By implementing these strategies, you can effectively manage stress and anxiety during your menopausal transition, promoting a healthier and a more balanced lifestyle. Another way to help mitigate some of these symptoms and to make that journey smoother is your nutrition and your hydration. They are key components in managing the menopausal symptoms. Having a balanced diet, like this picture depicts, eating the rainbow. So consuming a balanced diet that's rich in fruits, veggies, whole grains, lean proteins, and healthy fats can provide those essential nutrients to support your overall health and alleviate some of your menopausal symptoms. Foods that are high in calcium and vitamin D will also support your bone health and help reduce the risks of premature bone density reduction. Staying well hydrated with approximately 8 to 12 glasses of water a day is crucial for maintaining bodily functions and managing those symptoms like hot flashes and vaginal dryness. Aim to drink plenty of water throughout your day and to limit the consumption of things such as caffeine and alcohol that will also contribute to dehydration. Phytoestrogens, which are plant-based natural ingredients, including soy products, flax seeds, and legumes, may help alleviate symptoms by exerting estrogen-like effects in your body. Increasing omega-3 fatty acids, such as fatty fish like salmon, mackerel, and sardines. Again, flax seeds and walnuts are also high in omega omega-3 fatty acids. They may help reduce inflammation to combat those stiff and achy joints and to improve your mood during your menopause transition. And then last but not least, limiting trigger foods. So avoiding foods that may exasperate your symptoms, such as spicy foods, caffeine, and alcohol, along with highly processed foods that are high in sugar and unhealthy fats, can help manage symptoms like hot flashes, mood swings, and maintain a healthy weight. By prioritizing a nutritious diet and staying properly hydrated, you can support your body's overall health and potentially reduce the severity of the menopausal symptoms. Physical activity also plays a very high beneficial role during our menopause journey in helping manage those symptoms and promote an overall well-being. For our bone health, weight-bearing exercises such as walking, dancing, and strength training will help maintain bone density and reduce that risk of osteopenia, osteoporosis, and potential fracture and/or fracture complications. Physical activity also helps control our weight. That's commonly associated with that increase in abdominal fat weight gain associated to menopause. By general regular physical activity, we're burning calories and increasing metabolism. Exercise has also been shown to release endorphins and neurotransmitters that will boost our mood and reduce feelings of anxiety and depression that is often commonly experienced with menopause. Some studies have actually shown that regular exercise may help reduce the frequency and the intensity of the hot flashes and night sweats that are commonly reported by women during this period of life. Our cardiovascular health can be addressed through aerobic exercises like brisk walking, cycling, and even swimming to improve our heart health, to decrease our chance of high blood pressure, high cholesterol, and other cardiovascular disease risks, which also can increase during menopause periods. Regular physical activity promotes better sleep and helps regulate our circadian rhythms, which in turn helps reduce stress and contributes to improved sleep quality. That is, again, oftentimes a very prevalent and commonly reported symptom during the menopause journey. Muscle strength and our joint health can be improved by strength training exercises as simple as body weight strengthening to increase our muscle mass and to improve the joint stability, to reduce our chance of those musculoskeletal issues commonly seen during the menopause journey. So most health organizations usually recommend engaging in at least 150 minutes of moderate intensity aerobic activity, such as a brisk walk or cycling activity, or 75 minutes of a vigorous intensity aerobic activity per week, along with 2 or more days per week of muscle strengthening activities in order to maintain good physical health. Always consult with the healthcare provider before starting any new exercise regimen, especially if you have any other underlying health conditions and/or concerns. Now to the pelvic floor specific. Pelvic floor physical therapy can be particularly beneficial during the menopause journey for addressing the pelvic floor issues and improving our overall pelvic health. So we just spoke about general physical health and physical activity. We talked about the weight-bearing joints and the muscle loss, and our pelvic floor is also a group of muscles, so it shouldn't be ignored, and it always should be considered in your strength training regimen. Here's another few extra tips in addressing pelvic floor dysfunction with pelvic floor physical therapy. Menopause can lead to the pelvic floor issues that we previously mentioned, such as urinary incontinence, pelvic organ prolapse, and pelvic pain. Pelvic floor physical therapy aims to address these conditions through specialized education directed at your deficits, along with specialized exercises to address those deficits also. Pelvic floor physical therapy also focuses on strengthening the pelvic floor muscles with common exercises that you may be familiar with, such as Kegels and biofeedback. Improving muscle tone and control is often important, but oftentimes relaxation of these muscles may be just as important. So pelvic floor physical therapy can also improve the relaxation of these muscles, which may help with bowel and bladder control. It'll teach strategies to strengthening and relaxation and promote proper coordination of these muscles so that you're relaxing when it's necessary and you're contracting when it's necessary. The ability to alleviate pelvic pain. Many menopausal women experience pelvic pain or discomfort due to conditions like pelvic floor muscle tension and vulvodynia. Pelvic floor physical therapy utilizes techniques such as manual therapy, stretching techniques, relaxation exercises, strengthening exercises to alleviate the pain and improve function. Pelvic floor physical therapy can also address sexual dysfunction that's related to the menopause journey by improving the pelvic floor muscle function, again, promoting the relaxation and promoting blood flow to the pelvic region, which can enhance sexual sensation, pleasure, and reduce pain and dysfunction. Through the SimpleTherapy pelvic program that is available to you through your Pausitive Health membership, you will receive an individualized treatment plan to address all aspects of your pelvic health and to be addressed and directly specific to your issues and or concerns. So in order to identify the tension or the relaxation aspect of the concerns. So I'm going to turn over the talk now to Kim, and we will see if we've got any questions that we can answer for anybody.
Yeah, I put a note in the chat if anybody had any questions for you to please add them in the chat here, and we'll share those with you. I don't see any out there right now, but I do want to just kind of comment on the pelvic health aspect of what women experience during menopause and even post-menopause, because I have gone through it myself, and it's unbelievable how your pelvic floor muscles can tighten up and cause issues that are painful, are just provide a lot of discomfort. And I'm glad to see that SimpleTherapy has something to address that.
Right. I tend to find when I'm speaking with women and or patients, it may just be in a general conversation. It may be associated to a provider-patient relationship. Oftentimes, the urinary incontinence or the, I love the picture that we used of the lady crossing her legs in front of the couch. Ladies and women think that that's normal. They think, oh, I've had children, I've had some of these factors associated to that. And so they just think that's normal. And I should be going through that, where it's actually not a normal experience. And the downfall is somebody has not interjected there and given them that information that, just because 9 out of your 10 lady friends talk about this and have that doesn't mean that it should be normal and you should have to be experiencing it. With the use of pelvic floor therapy, those things can easily be reversed and managed, so that it's not considered the norm, kind of.
Right. Yeah. Nobody wants that part of their normal day.
Right. And I tend to find, ladies kind of like we just did, we just kind of giggled it off. We talk about it more in a fashion or a manner of, laughter, to make light of the situation. Or wouldn't it be great if you could say, well, I did these exercises, or I sought out my pelvic floor specialist with physical therapy and was able to resolve that. I think all 9 of those 10 lady friends' eyes would probably light up.
Right. Yep. Well, it's wonderful that Simple Therapy has this, some solutions for women in this space. And for those enrolled in the Positive Health program, if you look into your companion, you can find the links to get to the Simple Therapy enrollment if you haven't already done so. So please check that out in your companion. Are there any other questions out there?
Hi, it's Colette. I have a few. So, Kelly, can you go through again? I think that people think pelvic floor and they jump to Kegel, but you had mentioned that Kegel in certain circumstances can be counterproductive and actually make things worse. So, can you discuss that a little bit more?
Sure. Let me flip back to that page there. So absolutely 100% correct. Most people, when we start talking about pelvic floor, we jump to Kegels, or that's what's familiar or what people have heard of. But just as you identified, Colette, absolutely. If you are one that is dealing with tension of the pelvic floor, so we're having difficulty relaxing, performing a Kegel exercise could only worsen that case or that scenario. So the ability to be evaluated and to have that defining understanding of, are you a tension or are you a weakness issue? And that is where a pelvic floor therapist specializing in the pelvic floor or women's health comes into play, of being able to assist and identify that, so that you are getting the correct exercises. You're getting the ones addressing your issue and concern. So if you've only ever heard of those, or those are all you're doing, it certainly would be advantageous to seek out that pelvic floor therapist in order to identify that that's actually the concern that you need, and you're not causing more issues or concerns by performing what is kind of in the world known as the pelvic floor exercise.
And so, if I am in the tension category, would my symptoms be that a sense of tension, or would it be pain, or what would it be like?
Yeah, could be all. So it doesn't necessarily isolate you to only one symptom or another, but oftentimes we will have, with tension, in the tension category, we'll see higher incidences of constipation. We
Okay.
will see higher incidences of urges to urinate. And then when you get there, you're not able, or you're only releasing a little bit of urine at a time. So you feel like you are frequently visiting because you can never fully empty your bladder.
And then with regard to Kegel, when would you say would be a good time for people in general to start doing them? Or is it even a good idea for people to start doing them prophylactically before they have a problem?
Oh, sure. Yeah. So there's not a lot of negative to prophylactically doing them. It's not like if you did millions and thousands of them, are you going to set yourself up for a tension situation? Certainly not. They are certainly a general preventative exercise. You know, if we could get children, you know, mid-teen age individuals, females. I mean, Kegels are actually good for males too. They have a pelvic floor also. And so, you know, it's not something that I would advise to not perform prophylactically. However, if you're noticing increased symptoms, if they're painful to do, they should not cause pain.
Okay.
If they're painful to do, that's when I would seek care.
And then what would be a reasonable number to do and how frequently for it to have an actual impact, would you say?
You know, hard when, you know, if we're doing them from a preventative standpoint, you know, I would say 4 to 5 every time you sit down and use the bathroom, you know,
Okay.
which hopefully is multiple times in a day. You know, it's not something that you'd have to do hundreds and thousands, but consistency over time is going to be the key for effectiveness with really any musculoskeletal condition and exercise. It's the consistency over time that's going to be the big factor. So even if we're treating, we're not doing them preventatively. Consistency over time is the key factor there too.
Okay. And I know some people who I guess have either been too embarrassed or haven't known who exactly to go to with the problem. And so they start searching on the internet and they see lots of things about different devices and all of that. So, can you hit on that a little bit?
Sure, sure. Yeah, absolutely. There is a lot of commercial devices out there. Most of what you're going to see are intervaginal, so they're invasive. They're feedback machines. So basically, what they are doing is they are providing you feedback, usually through a mobile device or a computer app associated to the device, of the actual contraction that you're performing. So are they telling you whether you're performing them correctly or not? Not necessarily. Does it identify whether you need them or not? Absolutely not. It's basically giving you the feedback that you are actually contracting the pelvic floor. There are a few external ones that you would sit on instead of being inserted into, either for ladies, it would be the vaginal canal, for gentlemen, it would be the anus. And those are providing the same feedback, just without the invasive nature of the device. And so that is pretty much, when we're treating patients in a clinic, that's a personal choice, not required. It's not something that has to be utilized in order to be effective. But there's even over-the-counter ones now that you can, you know, purchase through pharmacies. You can purchase them through Amazon, has them, any of those type of devices. So they're not medically required, or do they require a prescription for purchase of them at all.
So it sounds like it really would be of great benefit to have the opportunity to talk to someone who specializes in this area, so that if that's something that in your particular case makes sense, fine and dandy, but to also make sure that you aren't buying things, not knowing what to do, and getting creating another problem that you didn't have in addition to the one you started off with.
Absolutely. Absolutely. Yeah. Back to kind of the discussion of doing Kegels if you happen to be a tension issue. You know, again, if you're using that biofeedback device, it's recording contraction or tension. So again, the identification of the issue is probably the, you know, at the top or at the priority of things to decide if that's being, you know, if it's a personal choice is it appropriate, and or is it going to give you feedback that is going to be helpful in your case or your situation?
And I don't mean to hog the conversation, but I have a few more questions. So in terms of so you've talked about how people, this is kind of a topic that is uncomfortable or embarrassing for a lot of people. And I would imagine that it also has can really bring people down and have them become stressed or anxious or depressed around that. So can you talk a little bit about that, since I know that there are some options available within the Positive Health program to help address those types of feelings and emotional distress?
Yes, absolutely. And as I had mentioned during the discussion of kind of the sleep cycle and the mood swings and the changes in just feeling good and physical health, right? Like it's just this big, huge interconnected loop that just seems like one thing moves into the next, moves into the next, moves into the next. And you're absolutely right. It is oftentimes I kind of push it under the covers and ignore those things, or I don't talk about them. You go to your primary care for your annual physical and you don't bring it up at all. And that's kind of one of the passions that I have had, is to try to take that stigma away from it. This is a natural transition that every woman is going to go through at some point in their life, and we shouldn't be embarrassed. We shouldn't be hiding those things. They should be at the top of the topic, and us as providers, we should be bringing those things up and offering those services. So those your EAP programs, if you're employed and you have employee assistant programs through your employer, through the Positive Health platform with the digital cognitive behavioral health, talking to somebody, getting the ball rolling. And even if you don't feel like you are at the level where you need care, get that ball rolling, get that conversation started, so that if it ever gets to the point where intervention is needed or you need to speak to somebody, you've started that ball rolling, and it's easy to get into care or to access that care that you need.
Okay, and I have one last question that's kind of off topic, but what is the McKinsey technique?
So the McKinsey technique is a postgraduate education process to refine the assessment process for PTs. So utilizing additional education, credentialing exams, re-credentialing exams to provide this bit more of elaborate is probably not a good word, detailed, a bit more detailed of an assessment process to identify the musculoskeletal issues within patients.
Okay, thank you.
Yeah.
I'm sorry to take over the whole thing.
Those were great questions, Colette. And I just want to add also, Kelly, that I know we spent a lot of time on the pelvic floor health and SimpleTherapy's program to assist with that. But, you talked a lot about just general aches and pains as well. And I know SimpleTherapy, for those that can enroll into SimpleTherapy, that, there's solutions out there to help you from head to toe. Literally, when your hands ache due to some joint pain, or your knees or your hips or your back. I mean, just all over, head to toe. There seems to be something out there from SimpleTherapy where their therapists are providing these different types of exercises and provide some consultations to help with all that. And you can, if you're not enrolled with SimpleTherapy yet and you're a Positive Health member, go out to your companion and you'll see a link in there that will direct you to SimpleTherapy so that you can enroll.
Oh, and I like that there's also the opportunity to pick among several different specific sports for exercises that will really help you in that particular category and help you avoid becoming injured.
Yeah, absolutely. Helped me with my golf game for sure. Okay, well, I don't see any other questions that's come up, so we'll just move on into what's coming up next here within our webinar series. You can go out to our pausitivehealth.com/webinars page to find all the upcoming webinars. And the next one is next week, where Skylar will be back again to help us with our mindfulness practice. And her focus is going to be on that vagus nerve. So be sure to sign up for that if you haven't already. And then in June, kind of continuing on with some of the pelvic health, we've got Dr. Lauren DeWinter joining us, and she's going to be really, focused on the bladder and the vagina. So tune into that. Go out to the site there to sign up for that webinar as well. And on the next page, we have our upcoming podcasts. Every month, we release a new podcast episode, and the next one being released is on osteoporosis and exercise. As Kelly mentioned, osteoporosis can be a big issue for women during this transition. So listen in on what Joan Pagano has to say about osteoporosis and exercise and the benefits there. All right, and then just one last plug-in here about, if you know someone who could benefit from the Positive Health program, they can sign up here at the site at positivehealth.gomohealth.care/enroll. And if you want us to send you information on that, please be sure to email us at info@positivehealth, and we'll be sure to get some information out to you if you need it. And also, if you know of any companies that would like to provide education to their employees about menopause, then they can contact Dave. His email address is ddrap@gomohealth.com. He's our partner in helping us with our employer exchange. So with that, I'd like to thank you, Kelly, for this great presentation. You provided, some really good insights for me, and I hope as to the audience as well. And we'd like to thank you and our audience for joining us today. I hope you all have a wonderful day.